Hello.
Hi, Dr. Williams. This is Aaliyah. Could you start by just telling us what your background in dentistry is?
My background is about 45 years worth of beating the drum. I've been doing dentistry since 1975, and I got started in my first class was in St. Petersburg, Pete Dawson's class, and I came back and went to Harold Gelb's class, and said, "This is conflicting information." And then I went to Barney Jankelson's up in Seattle, and I said, "This is compatible information with what Harold Gelb was talking about." So with my background in occlusion and TMJ early on, I started teaching TMJ orthodontics and reconstruction back in the early 80s. Traveled around the United States as an instructor for the United States Dental Institute, and I enjoyed that. We started a group called TMJ Framework, which was a mini residency type program that Larry Tilley and Dale Madsen and Dennis Simmons and I put together. And we ran that for 10 years. And eventually, I sold the practice in Stone Mountain where all that went on, moved up to Suwanee at age 48, started over again. And I built a nice big practice that I still practice in. And I've been in business now 45 years.
That's awesome. So, what you're doing right now, is that still teaching and focusing on TMJ?
Not really. I can't say I don't teach TMJ because I gave a lecture just the other day at International College of Craniomandibular Orthopedics, ICMO, at their international convocation. And I spoke on some things about TMJ, but what I really focus on mostly is practice management, how to build a profitable practice, how to market and grow your practice is more my favorite. I still teach implants and bone grafting and oral systemic connections. So there are clinical things that I like to talk about, but the business of dentistry is really my significant focus.
Would you say that that's also like the most interesting part of dentistry for you, or is there something else about dentistry specifically that interests you?
Well, my attention is really focused on the Redox signaling technology right now. It's a new emerging science, and it's never come to dentistry until this year. And so I'm bringing, along with Dr. Lee Osler, I'm bringing Redox technology into the dental practice and showing how it works, teaching dentists and hygienists and the people that work with us how to implement the program so that people get the advantage of having this health and wellness supplement added to their daily regimen. I've never seen anything quite like it in all my years of practice, of something that will benefit more people so simply. And so I made it a mission to focus on that over the next 5-10 years, in addition to what I already do, which is teach dentists how to run their practice, grow their practice, and do what I call the decathlon dental techniques, the implants, the bone grafts, the TMJ, neuromuscular dentistry.
You talked a little about technology. How have you seen that impact your specific practice?
I've always been a high-tech kind of dentist, and we computerized in 1981. We got the kinesiograph, the forerunner to the K7. We got that K5AR back in 1979. So I've always been on the edge of whoever's creating something unique. I've tried to find and use it. I got a T-scan back in '87. So if I had a $1 for every toy I bought, I'd probably have a lot of dollars saved rather than spent. But I think the toys made me money. They gave me a significant advantage over other dentists that didn't get into the toys and the high-tech equipment because I could do things they couldn't do. I've already gotten on my second CAT scan. I had one 10 years ago, and now I've got another one that's advanced. So it's just a matter of staying on the edge of learning, staying on the edge of technology, and you'll always stay ahead of the curve that way.
I guess that kind of brings me to MyLiner then. I know you've had a chance to use a couple of our appliances. What do you think in general about the MyLiner appliance?
Well, that's an interesting question. And years and years ago, I was using neuromuscular appliances, and the Jangelson appliance was our standard that we used ever since 1979. I've used a variety of mandibular orthotics that simulate teeth, and I was never happy with them. I've practiced most of my career unhappy with the actual orthotic, and it was because I would send the Malbite down to a lab, and they would return a piece of plastic that was a block of acrylic with holes in it that just had where the cusp would sit, and they didn't really look like teeth, and it was like I couldn't really identify the lab that I thought would replicate the teeth. I'm sure they existed, but I never found them. So then one day last year, my friend Nick Meyer suggested that I try the MyLiner because it was anatomical, and it was done with CAD/CAM or some kind of a process that made it more durable and also more flexible than acrylic. And I go, that sounds good. I'm going to try it. And I've used a number of them now, and I really do like it. I probably will use it on every case now from now on, as long as I practice. Until something comes along better, I think this is the way to go. They fit good. They look good. People will wear them a lot better because they don't look unlike teeth.
Can you speak to how they've impacted your patients' lives?
Well, the orthotic at the right height is going to speak for itself. If you're a neuromuscular dentist and you know exactly what you're doing, the orthotic in the right place is going to dramatically improve patients' lives. If you reduce their muscle stress and put their jaw in the right position, that's designed right, it's going to go well. But the thing about it, the MyLiner looks like teeth. It can act like teeth to chew and speak. And if that's the case, they're not going to take it out. They're going to wear it more, and they're going to be a lot more compliant. And that's one of the biggest things for me is compliance. And they don't look funny wearing it, so they don't mind wearing it.
How do you think that the unique segmented design makes MyLiner different from other orthotics?
Yeah, I've never had an orthotic that fit as intimate to the teeth as these. The retention is far better, and when it's in 3 segments, then I've got the opportunity to take it out and do some orthodontics. I've got the opportunity to cut pieces off of it and do orthodontics. I've got the opportunity to, in a step by case, I can even leave the front segment out because the front teeth can get coupled. And so I can have a 2-section instead of a 3-section orthotic, depending on what I want and how the patient feels about it. So got a lot of options. I think it's very flexible in terms of capabilities.
Awesome. So I just have one more question then to wrap it up. What would be your advice for new dentists?
My advice to dentists, if they don't know neuromuscular dentistry, is to learn it. If they already know neuromuscular dentistry, then they need to experience what a MyLiner will do for them as far as extending their reach. You can do more with the technique. I think the patients like it better. I think they're better compliant. And, as long as the technology is there, you might as well use it.
Awesome. Cool. Well, thank you for your time. Thank you, Dr. Williams.
Appreciate you. Thank you much.
Have a good day.